Okay, it is 3 p.m. Eastern Standard Time, and this is another episode of Dr. Yass live on YouTube. And today's discussion, as I had put out, is about the lower back. And I had mentioned that I'd be discussing the typical diagnoses of stenosis, spondylolisthesis, and spondylitis, and that I would like to give an overview of the lower back and get people to understand what the potential tissues are that might be causing their pain, and to understand why those diagnoses that are derived from an MRI are typically basis in interpreting what tissue is creating your lower back symptoms, so that you can get the appropriate type of treatment that would help to resolve the distress of that tissue, so you could go on and be pain-free and fully functional. And so I'd like to point out that I try to keep this an open forum, and anybody who comes in who wants to ask a question specific to their situation, by all means do so. I'd like to be able to give people applicable information. It's not enough to talk in generalities. I really like to talk in specifics so that people understand what they need to do to help resolve their pain. Over 27 years, I have shown that in more than 98% of cases, the cause of pain is muscular in nature, meaning that the tissue in distress responsible for your pain or other symptom is muscle. And the great news about that is the fact that muscular deficits can be corrected fairly easily through the use of progressive resistance exercise, which is the type of exercise that is at the core of the Yass methods, which I affectionately describe as Yassercise. And so this type of exercise allows you to isolate individual muscles and allow those muscles to work against a progressive resistance, a resistance which becomes greater and greater and forces the muscle to adapt to that resistance, thereby causing the muscle to get stronger and bigger, ultimately to the point where the output of the muscle is greater than the force requirements of the activities you're performing, and therefore you can be pain-free and fully functional. So that's the great news. And the beauty that the Yass method brings to individuals is that it turns out that in the vast majority of cases, I'm talking 98% or greater, the cause of your pain was muscular, and all you need to do to resolve that deficit is to simply perform the appropriate exercises using progressive resistance exercise. So I want to start by giving some background as to where we are, and then we'll go forward in our understanding of why the existing system seems to be failing. And that's not confusing to most people, I don't think. I think most people know people who have had back fusions, hip replacements, knee replacements, all these surgeries, and have turned out to have much greater symptoms. The evidence shows that the higher percentage of back surgeries fail. And in fact, the medical system created the diagnosis failed back surgery syndrome to account for people who end up having the same exact, if not greater pain after the surgery as before the surgery. So just recognize that the medical system themselves have recognized that there's a failure. Something's not working correctly because they developed this diagnosis of failed back surgery syndrome. And it's fairly rampant. I'm sure that of those people who have had failed surgeries where their symptoms are the same, if not greater, after the surgery they had, they were probably given the diagnosis failed back surgery syndrome to proceed with treatment. The idea is that I would imagine that it's fairly difficult for a doctor to get an authorization for the same exact fusion that they did once and are suggesting that it has to be done again. So I guess the idea is that if I could give a new diagnosis, which is failed back surgery syndrome, that allows me to proceed under the same mechanism I had been proceeding prior. So let's just talk about the general premise by which people are diagnosed. So I think everyone, there can't be much confusion about the fact that typically you have some sort of pain. We're discussing lower back today. So you have lower back pain, you go to the doctor, you seek some sort of treatment, and pretty much everyone acknowledges that you're going to get an X-ray or MRI. That is the primary mechanism by which you will be diagnosed. Now, you want to understand about the MRI that what it's finding are structural variations. Muscular causes will never show up. This is critical to understand. Only one aspect of the potential causes that could be creating your symptoms will show up. And the typical types of diagnostic findings relate to the lower back are things like spondylitis. And I'm going to try to give you the understanding of what these actual terms mean. So spondylitis is arthritis of the spine. Most people know you'll get the diagnosis osteoarthritis of the knee, the hip, the ankle, the shoulder. Well, the same exact diagnosis at the spine is simply called spondylitis. Another diagnosis is stenosis. So stenosis, just so you understand, that word in English means narrowing. And so what that represents, let me show you. I have pictures, so I'd like to try to show you these pictures. So here, we'll show you a picture of stenosis, which is to say narrowing. So if we were to look at these spaces here, we're looking up here. So they're pretty big. And then as you start to come down here, you'll see that that gap shrunk. You see how the space between those two vertebrae got smaller? It narrowed. So the idea is that representation shows you what would be diagnosed as stenosis. Now, if you notice, they're trying to show you that the disc is herniated, and it's actually sitting outside the circumference of the spinal column. So the key thing to understand is that these all kind of represent the same thing. So stenosis is the narrowing of the space between the two vertebrae. A herniated disc is supposedly the representation when you narrow it, you're going to push out a portion of the disc. And that's what you see there. And then you have nerve roots that come out, which are coming out at every level. So if the disc then pushes out, it can compress the nerve root. So hopefully everyone can see that stenosis, a herniated disc, or a pinched nerve, which is never a nerve, in fact, it's a nerve root, are basically one and the same. They're just talking about different aspects of the same mechanism. You have the narrowing of the space between the vertebrae. You have the disc being pushed out posteriorly to the back, and you have that disc impinging on the nerve roots. So just so you understand, stenosis, which sounds so scary, is really the same mechanism as being diagnosed with a herniated disc or a pinched nerve. They represent the same exact thing. And yet that diagnosis of stenosis sounds so scary because it's a term that you've never heard. And that sounds, it's a medical term. That's going to scare some people. So that's the first one. So as I mentioned, I don't think I really have to go through showing you a picture, although I do think I did develop a picture here. Let me see if I have that picture. Let's see. Let's see. Well, we'll work on this. Oh, here it is. Yeah. So if we look at this here, you see the decay all the way on the bottom here? If we're holding this here, down here. So that represents degenerative disc disease, and that kind of crumbly aspect at the ends of the vertebrae represent osteoarthritis or spondylitis, arthritic changes of the vertebrae. Okay, so here's spondylitis. It just means that the surfaces of the vertebrae are not smooth anymore. They've developed calcium deposits on them. That's all. That's all that represents. And then finally, I can show you the one that sounds the scariest is spondylolisthesis, which here represents this vertebrae shifting forward slightly. Instead of being directly in alignment here, you can see that that shifted forward slightly. So spondylolisthesis represents a shifting of a vertebrae front to back. And in this case, it slipped forward slightly. Now, the important thing to understand about these things are they natural phenomenon? Are they things that occur to pretty much everybody throughout their life and kind of is associated with the aging process? But I hate to say the aging process because aging doesn't necessarily mean that has to happen. It's really a question of wear and tear because of the fact that people have never really been trained to understand that the position of bones is based on the pulls of muscles. So if you had strong and balanced muscles, your spine would be aligned perfectly. You wouldn't have any shifting of vertebrae. The center of the disc would be maintained in the center of the spinal column, so you wouldn't have a herniation. You wouldn't get pinched nerves, right? So all of these types of things that are happening are actually a result of the fact that you don't sustain strength and balance of your muscles. So as a result, the forces that are running through your spine vary. And that's what leads to these type of structural variations. But these structural variations are very, very slow in their progression. They're deteriorative in nature. They do occur, but they're so slow that they actually never emit a pain signal. Remember, why does the body elicit pain? It elicits pain to create awareness of a tissue in distress. That tissue, the tissue in distress, is the one that's igniting the pain signal so that that pain signal goes to the brain. You say, oh my God, I feel pain. Why do I feel pain? Well, it's because there's a tissue in distress that's trying to make you aware of it so you can perform an intervention or get an intervention performed to resolve the distress of that tissue. Once the tissue's distress is resolved, that tissue no longer has to elicit the emergency distress signal of pain, and it stops. So in trying to resolve the pain or other symptom, you don't actually address the symptom, right? We're trying to address the tissue in distress. That's the nature of diagnostics. Diagnostics, the purpose of diagnostics is to identify a tissue. At the end of the diagnostic process, a narrative has to be given that says, based on something, in my case, the Yass method, we use a presentation of the body's symptoms. And from there, we say, well, based on that, we can determine that the tissue in distress is this tissue. And then the recommendation is to do this to resolve the distress of that tissue. Once that tissue's distress is resolved, your body won't elicit symptoms anymore, or that tissue won't elicit symptoms anymore. Does everybody hopefully understand the idea here as to what we're trying to do? What is the purpose of diagnostics? Why do we try to establish a tissue? Why must there be a tissue named at the end of the diagnostic process? Right? Without that, what am I working on? Not just pain. And forever, I truly believe that people stay within the medical system because the medical system perpetuates the idea that that MRI found the correct diagnosis, that spondylosis, stenosis, or spondylolisthesis is in fact the cause of your symptoms, but that they keep trying different treatments and you just haven't come upon the right treatment. So the answer isn't to worry about the diagnosis anymore. It's to worry about getting the right treatment. And that's why people end up like shopping. Oh, I'll try chiropractic today. I'll try acupuncture today. I'll try an epidural nerve block today, right? It's all the idea of I'm going to just keep trying different treatments to see if that's the treatment that resolves my symptoms, but that's foolhardy. Because if you haven't established the right diagnosis, the right tissue in distress, then you're just spitting on a wall and hoping that you're going to get something to stick. And the highest probability is that you're not going to get something to stick. And that's why all the treatments in the world don't work and why people end up with chronic pain. Hi, Diana. Thanks for being on the session. She just wrote so the spinal area only has nerve roots, and those nerve roots don't elicit pain. So that's a good question. So first, I just want to point out there is a common tendency for medical people to convey to people that nerves come from the spine. That's a fallacy. They are nerve roots that come out of every level. Those nerve roots create symptoms in very specific areas. So let's look at that. So your question is, these nerve roots don't elicit pain. They may, but for you to say that the nerve root is creating pain, you must have pain where the nerve root innervates that area of skin. And that can be identified through what is known as a dermatonal chart. And if we look at this chart, you're going to see all these small letters, L1, L2, L3, L4. Up here's the thoracic, up there's the cervical. And if you notice, let's say that we're looking at, I think this should be L3. I think that says L3. Oh, that's L4. L3 is right here. L3 is over here. So if someone said that the L3 nerve root was creating your pain, you would have to have pain in the front of your thigh. If someone said that the L4 nerve root was creating your pain, you would have to have pain at the inner portion of the shin, because you can see the L4 nerve root runs down to here. L5 would create pain at the outer nerve root. So let's be very clear. A nerve root does not cause pain at the lower back. You'll see that they have created this like little slitty thing here. But that's ridiculous. No one has pain in very small slivers. People's pain runs right across here, from here to here, here to here. And that would pass multiple nerve roots. So it's foolhardy to think that any nerve root is going to cause pain in that whole area of the lower back. So this is critical to understand. And Diana's point is really important to understand that if, in fact, you have a diagnosis at the lumbar spine, and let's say, for instance, it said you had a L4-5 nerve root impingement, don't expect that pain to be here. Never expect the pain to be there. You would have to expect the pain to be in the inner shin, because that's where the L4-5 nerve root creates its symptom. The lumbar nerve roots create symptoms in the legs, not the lower back. They create them in the legs, okay? So that is a really, really important point to make. So when we talk about nerves, for instance, we talk about sciatica. Well, the sciatic nerve is a nerve, not a nerve root. So it is actually comprised of 7 nerve roots, L4, L5, S1, S2, S3, S4, and S5. So 7 nerve roots form. But if you were to look at this photo, you would see all the way up here are these little nerve roots, and eventually they come down here and they form the sciatic nerve here. This is where the sciatic nerve begins, right here. It's right here. It's on the outside of the pelvis. It's away from the spine. So the sciatic nerve begins here. So for someone to say that an L4-5 nerve root impingement is creating sciatica, sciatica, by definition, is a symptom that runs from the gluteal region down to the foot at the back of the leg. So for anyone to say that something here at the lumbar region creates sciatica is foolhardy. As I just showed you, the L4 nerve root creates symptoms at the inner shin. The L5 nerve root creates symptoms at the outer shin. The sciatic nerve, which is huge, comprised of 7 nerve roots, that's what creates symptoms from the gluteal region all the way to the back of the leg, all the way down to the foot. So for someone who's having sciatica, and me and Diana have been having discussions, she's been going on to some websites, some groups, forums, and they talk about sciatica, and it's always associated with something with the lumbar spine. And that's just complete fallacy. There's no way that any structural variation at the lumbar spine could ever create sciatica, because the sciatic nerve doesn't attach anywhere near the lumbar spine. It begins in the gluteal region. So let's make sure we understand that. The only thing that's coming out of the lumbar spine are nerve roots, not nerves. And those nerve roots innervate the leg. They are not going to create symptoms in the lower back. Okay? So what happens? Why is it that if people have pain at the lower back, that they are diagnosed with a herniated disc, pinched nerve, spondylolisthesis, any of these types of structural variations, which are identified? We acknowledged that the way this works is that the person goes for a diagnostic consultation and the MRI is taken. So the structural variation is identified at the time you're having your symptoms, and it's asserted, since it's found for the first time at the time you're having your symptoms, it must be the cause of your symptoms. That is what is known as correlative theory. I wish that we can get everyone to jump on board here and recognize that what is being used is what is also known as junk science. Correlative theory is junk science. It simply says that if something's happening while something else is happening, I can say this thing is causing this thing. So an example of that in outside of the body is if I open my front door when the sun rises, I can say opening my front door causes the sun to rise. And everyone would say that's insanity. Well, the idea of finding a herniated disc when you're having lower back pain, saying that the herniated disc must be causing it simply because it's identified for the first time, is the very, very same insanity. So we want to look at certain aspects of this. So the determination from the medical system was to say that herniated disc caused lower back pain. Well, if that's true, then it must also be true that people who don't have lower back pain shouldn't have herniated discs, right? Can you see the idea there? If you're saying lower back pain is caused by herniated discs, then those people who don't have pain shouldn't have herniated discs. And studies have shown that the mass majority of people actually do have that. I'm going to actually go and I want to show you some studies that I'd love you to be able to look up and see. Another just general point would be, well, if you're simply saying the only reason that you're calling a herniated disc the cause of your pain is because it shows up, well, many other things can show up on an MRI, right? So what about the fact that the MRI would show that you have two elbows? I think the MRI would show you have two elbows. So then why isn't two elbows the cause of your lower back pain, right? Can you see that that simple attempt to create that relationship just doesn't work? It doesn't work because it's baseless. It's baseless because it's utilizing one of the most rudimentary false prepositions of logic, which is correlative theory. It just doesn't work, okay? So I wanted to go on and try to show you some things that have come out over the years which truly represent what to me would be obvious indications that this situation of using MRIs is baseless. So here we have, this is the Annals of Internal Medicine. This is a position paper that was created by the American College of Physicians. This was done in 2007. So we're talking about 13 years ago this happened, and yet it was ignored. And the position paper is Diagnosis and Treatment of Lower Back Pain, a clinical practice guideline. So these are the people who set the guidelines for all the doctors in the United States. A joint clinical practice guideline from the American College of Physicians and the American Pain Society. Now, the important thing to understand is that they established these guidelines by doing a 40-year literature search. They started going through studies that were presented in Medline, which is kind of the gatekeeper of all studies that are done medically, and some other databases. And they went from 1966 through 2006. So they took 40 years of studies and started analyzing them to see if they could come up with conclusions based on the way treatments were being performed, the way diagnoses were being developed, to see if they could come up with a better way of guiding doctors in how they want them to treat lower back pain. And so one of the components that came out, I want to read this really slowly and carefully. They established over this 40-year literature search that more than 85% of patients who present to primary care have lower back pain that cannot reliably be attributed to a specific disease or spinal abnormality. I'm going to read that again. More than 85% of people who present to primary care have lower back pain that cannot be reliably attributed to a specific disease or spinal abnormality. What is the purpose of the MRI? To try to attribute lower back pain to a spinal disease or abnormality. They're saying that their studies showed that over 85% of people who are attending primary care could not have their pain attributed to a spinal abnormality, like a herniated disc, stenosis, arthritis, all these things. 85%, that's the majority of you. This is coming from the American College of Physicians and the American Pain Society. They have acknowledged 85% of you cannot have your pain attributed to a spinal abnormality. Moreover, no evidence suggests that labeling most patients with lower back pain by using specific anatomical diagnoses improves outcomes. I'll read that one again. Moreover, no evidence suggests that labeling most people with lower back pain by using specific anatomical diagnoses improves outcomes. Every one of you who seeks care through the medical system for lower back pain will be diagnosed and have your pain attributed to a spinal abnormality. And here are two of the most renowned medical bodies, the American College of Physicians and the American Pain Society, telling you no evidence suggests that labeling most people with lower back pain by using specific anatomical diagnoses improve outcomes. If that's true, then why the hell? This is 2007. 13 years later, you're still having your pain attributed to a spinal abnormality and using that diagnosis as the means by which you get treated. It's insane to think that this continues to go on. This was sent out 2007. This should have been an immediate moratorium put on the use of MRIs. This is 2007. And yet it just continues. It was ignored. So they came up with recommendations. And they actually wrote, there is no evidence that routine plain radiography in patients, that's x-rays, with non-specific lower back pain. Remember, what percentage of people have been said to have non-specific lower back pain, which is to say that it cannot be attributed to a spinal abnormality? 85%. So there is no evidence that non-specific lower back is associated with a greater improvement in patient outcomes than selected imaging. So it doesn't matter whether you take an X-ray or an MRI, there's really no improvement in outcome. In addition, exposure to unnecessary ionizing radiation should be avoided. This issue is of particular concern. So they're telling you, they just want to keep giving you X-rays and MRIs. But in the case of X-rays, they're saying that that is potentially dangerous based on the level of radiation. Okay. Routine advanced imaging, computed tomography, or magnetic resonance imaging is also not associated with an improvement in outcomes and identifies, here's the money right here, and identifies many radiological abnormalities that are poorly correlated with symptoms, but could lead to additional, possibly unnecessary interventions. Are you getting that? Routine advanced imaging or magnetic resonance imaging is also not associated with improved outcomes and identifies many radiographic abnormalities that are poorly correlated with symptoms, but could lead to additional, possibly unnecessary interventions. They're telling you straight out. There's no correlation between the findings, these structural findings that are being picked up on diagnostic tests, and worst off, they're openly acknowledging it could lead to possibly unnecessary interventions. Well, if you pick the wrong diagnosis, wouldn't you expect any intervention to be of no value? Unnecessary? Okay, let me just pick this up. I have been diagnosed with lumbar spinal stenosis and have been doing acupuncture for chronic fatigue and leg weakness. So let's talk about that. That's a fabulous message to put down a comment. I've been diagnosed with lumbar spinal stenosis and degenerative disc, and have been doing acupuncture for chronic fatigue syndrome and leg weakness. So I guess the attempt was made to say that your weakness, your fatigue, and your leg weakness is associated with these structural variations. So my question to you would be, what is the connection between your symptoms and these structural variations? Isn't it possible that your symptoms are independent of these structural variations, and these structural variations probably have existed for years and actually exist but are independent of your symptoms? Isn't that a possibility? And if in fact these structural variations are the cause, what would correct the what's going to correct spinal stenosis, narrowing? What's going to correct degenerative disc disease? Irritation of those discs at the endpoints because you've gotten the compression. Only surgery would correct that. So why would there be any attempt to do anything outside of that in terms of addressing these structural variations? Well, in terms of addressing the structural variations, the failure rate clearly is somewhere between 78 and 80%. And as I said, they created the diagnosis, failed back surgery syndrome. So there's an acknowledgement that even the attempt to treat these don't end up doing anything in terms of the symptoms. What you really want to come home with is the point of the idea that symptoms can be independent of structural variations. Let's say we found a person, and this is what I'm trying to get people to understand. Let's say I was evaluating a person who was in their 80s and they had wrinkles all over their face. Those wrinkles are clearly structural variations to the skin, right? No one's going to deny that. Why can't I then say that those wrinkles are the result of the fatigue syndrome and the leg weakness, right? Can you see that? Can you see that I could make the same comment just as they're saying that the lumbar spinal stenosis and degenerative disc disease is the symptom, is the cause, just by saying I see wrinkles, therefore, since the wrinkles exist at the time you're having your symptoms, that is the cause. It's the same premise, and it's a false premise. It's a false premise. I can show you, here's, I'd like to, if you can, just let me just show you this here. So this was a study that was done regarding actually degenerative disc disease. And what happened was they did a literature search, and the conclusion of the study was that imaging findings of spinal degeneration are present in high proportions of asymptomatic individuals, increasing with age. Many imaging-based degenerative features are likely part of the normal aging and unassociated with pain. These imaging findings must be interpreted in the context of the patient's clinical condition, right? So what they're really saying is, all right, they probably have these structural variations like degenerative disc disease, but we really want to interpret the symptoms to see if there's some connection. It can't be any symptom, right? If I have pain over here and I have degenerative disc disease, is that the cause as equivalent if I've had the pain here or anywhere else? You can't use that mechanism just because it was found at the time you're having your symptoms. It doesn't work. They actually pointed out that all imaging findings examined in this review had an increasing prevalence with increasing age. And some findings were present in nearly 90% of individuals 60 years or older. Our study suggests that imaging findings of degenerative changes such as disc disease, disc loss, disc height, disc protrusion, and facet arthropathy are generally part of the normal aging process rather than pathological processes requiring intervention. The results from this systemic review strongly suggest that when degenerative spine findings are incidentally seen, an indication other than pain or an incidental disc herniation at a level other than where a patient's pain, these findings should be considered as normal age-related changes rather than pathological processes. So everybody's kind of acknowledging through all of these studies that this stuff exists. There's just no way around it. It all exists, but that they're independent of symptoms. And therefore, they have to be disregarded as the potential cause of pain. So, let's see, let me catch up here. As someone who has many MRIs, this is astonishing. Since the lockdown for the coronavirus, I haven't been able to do acupuncture until yesterday since March. I've been experiencing muscle tightness in the gluteus maximus and pain in the tailbone. What is the cause of this symptom? Very good question. Now, let's talk about the Yass method and how it can be used to try to address your issue. So, I would suggest, which side is this on? Is this the right or the left side? If you could tell me the pain in the gluteal region, if it's the right or the left side, that would be helpful. And then we could talk about that. So, actually, I think I have a picture to show you something that will help you understand what's creating the symptom in the gluteal region. Here we go. All right, my friend. So if we take a look at this picture, can we see this right here? Can you see that? That is called the piriformis muscle, left side. The piriformis muscle. Can you see that? That muscle attaches from the hip and attaches into the sacral spine. Here's your tailbone right here. This is the coccyx. Here's the sacral spine. This muscle attaches into all 5 sacral spine bones and runs diagonally through the gluteal region to the hip. Okay? So my suspicion is that what you've done is, so you have weakness on both sides. One is weaker than the other. And what's happening, it's causing that piriformis muscle to strain. And because it's strained, it's eliciting pain in the gluteal region. You just happen to be feeling it on the side of the muscle, not at the hip side that it attaches, but at the side where it attaches to the spine. So one of the ways of representing this is you can try to single leg stand on one side and single leg stand on the other leg and see if one is harder than the other. I would suggest that possibly the left side might be harder. If you want, go ahead and try that and then let me know if it turns out that the left side is harder to single leg stand than the right. And you'll notice whichever side you're standing on, if you're standing on the left and trying to do it, you will fall to the right. And if you stand on the right, you'll fall to the left. Sciatica on the left side. Well, there's your answer to that. Same exact picture. Everything you're describing is everything that the Yass method can answer. What is this right here? You see what that says? The sciatic nerve. The sciatic nerve runs straight down, and the piriformis runs diagonal to the gluteal region and can impinge on the sciatic nerve when it strains and thickens. So pain in the gluteal region, sciatica, is all still associated with a muscular cause, which is a strained piriformis muscle impinging on the sciatic nerve. You've just described the fact that you're having a weakness which is caused by a strain independent of your spine. This has nothing to do with anything. So if we look at, I didn't create that picture, but there's a muscle that sits right here called the gluteus medius muscle. And that muscle is attached from here right to here. That's what keeps your pelvis level. If this is your leg and this is your pelvis, the goal of the gluteus medius is to keep your pelvis level. If it's weak, it'll fall, and you'll fall to the opposite side. So it's supposed to be giving you balance and stability. And if that muscle strains, the piriformis, which sits right next to it, will strain as well. And that's what leads to the pain in the gluteal region and to potentially, if it thickens enough, sciatic symptoms, right? So that's what's probably, almost can guarantee, the cause of your pain has nothing to do with your back. It's a hip-related issue. If you look at the gluteal region, any muscle, any of these muscles, you'll see anything that runs from this area always runs to the hip. Anything in this gluteal region runs to a hip. So what you're describing is the fact that you have some sort of hip dysfunction, an inability of you to perform properly what should occur at the hip, which from the point of the gluteus medius is developing balance and stability. And you're not getting it. So for you to resolve sciatica, for you to resolve gluteal region pain, you have to recognize you have a muscular cause, and you have to know which muscles to strengthen, and you have to know how to utilize Yass, which is the exercise that I utilize within my method, which allows you to isolate individual muscles and allows those muscles to work against progressive resistance, more and more resistance, which ultimately allows the muscle to get stronger to where their force output, the amount of force that the muscle can create, is greater than the force requirement of your activity, whether it's standing, climbing stairs, kneeling down, whatever you're trying to do has a certain force requirement because gravity is pushing down on you. So you have to recognize that for you to be able to do these activities without having symptoms from a muscular cause, you have to have the appropriate strength in all your muscles. And that's where the Yass method comes in. I'm not familiar with any medical specialty who is educated or trained to treat muscular causes. I am pretty confident there is none. And so people like you, which is incredibly sad to me, end up suffering with chronic pain because you're seeking an understanding of the cause of your symptoms from people who are incapable of understanding that particular cause. And that's why you will have chronic pain. Chronic pain is an oxymoron. The idea of chronic and pain should never go together. They're independent. So when does pain begin? At inception of distress of a tissue, right? That's when the pain begins. The tissue goes into distress. It elicits the pain. So if you were using an appropriate diagnostic model like the Yass method, you would be able to identify that tissue in its acute stage, resolve the distress of that tissue, thereby ending pain always in the acute stage. The only reason why chronic pain exists is misdiagnosis. Quite simply, you're treating the wrong tissue. Why? Because you depended on the medical system's promotion that the MRI is a valid mechanism for establishing what tissue's in distress. And the reality is it's just not. It's baseless. It is absolutely baseless. And I think the scary part is that most people think it must be valid because it's used globally, right? But I can tell you now, George Washington was killed by his doctors. And that is because at the time, the global understanding of how to deal with infection was doing bleeding, which was to use a razor-like device to cause blood to come out. And they thought in getting the blood out, they're getting the infection out. Well, George Washington happened to have pneumonia. His throat had already swollen, and they used slits. What did that do? It caused a greater inflammatory response, and he ended up suffocating, right? So George Washington died not because these guys were evil. It was because at the time they used what they thought was the most up-to-date mechanism. It turned out it was just baseless. And there's multitudes of times, right? If someone had a headache in the 1920s, they bore a hole in your head. If you had some sort of behavioral deficit, they did a lobotomy. Right? There's been plenty of situations where the medical system has been wrong. This, to me, is the most egregious because every bit of evidence, not scientific, where studies have shown, there isn't a single study that shows there is a correlation between what an MRI finds and it as the cause of pain. There's not a single study. From a theoretical basis, there's just it makes no sense. You're using correlative theory, which is a joke. And from a clinical sense, where people's symptoms are not where you would expect them to be if, in fact, that particular structural variation was creating the symptom. So nothing says that the MRI works, but it's constantly used. And that's why people continue to have pain. That's why you had an opioid epidemic, right? So you wrote, I figured out that it was muscular, which is great. So now you just have to know how to identify which muscles are involved in the symptoms you're experiencing and just use the appropriate exercise and you must use, this is another part. So whether it's anyone in the medical system, whether it's fitness people, no one really understands the way of getting the two components necessary for strengthening muscles appropriately, which is to isolate the muscle using the correct exercise and then causing that muscle to adapt to greater and greater resistances. That's the two pieces you need. And those are the two primary components of Yass. And as far as I know, this is the only location, the only place where you could get that type of understanding, how to isolate muscles against progressive resistance. So if you want to contact me and we could discuss this outside of this session, I'm just going to put down my email address. Okay, so there's my email address, Dr. Mitch at mitchellyass.com. If you want to contact me, we could discuss setting up a Skype session or a Zoom session if you want to do that. The book that would actually help you, if you want to know the specific one of my books that I've written, is called The Pain Cure RX. That is the book that breaks down body part by body part and allows you to use the very same test that I would be using if you were with me, and that tries to teach you how to utilize those techniques to evaluate and determine which muscles are creating your symptoms. And then once you've identified that, the book shows you how to perform the exercises that would be necessary. So you could use that. You have one of those two choices to resolve pain. You could use my books, or we can go and we could do a live session through Zoom or through Skype. And as you've mentioned, we have this pandemic thing, so nobody's doing any in-person stuff. So this is the perfect time to try to get a Yass evaluation and treatment. I'm a patient and he's awesome, Diana said. I've worked with Diana and she's resolved her pain. And that's a wonderful, wonderful thing to be able to have someone come on when I'm doing these sessions and say that they've walked the walk, they've talked the talk, or they've talked the talk and walked the walk, and they've seen that this method is the only method that truly can diagnose and treat the cause of pain. So can we just go on a little bit further and let's look at one more diagram so that we can talk about, I've kind of made you feel and hopefully recognize that structural variations in most cases are not the cause of lower back pain. So what is? There are two primary muscle groups. So this is looking from the front to the back. And so this is your spine. If we look right off the spine here, running from the bottom of your rib cage all the way through the lower back to the top of the pelvis, this is what's known as the quadratus lumborum, or most people know as your lower back. How about here? What's this? Look at that big chunk of muscle. Look at that monster, right? These are your hip flexors, your psoas muscles. Many people have heard of those. Where does that attach? All 5 lumbar spine. They run through the front from the back of the back forward diagonally to the hip joint, right? So you could see that there's a muscle that runs from the back to the hip joint. So there is a possibility that this muscle could strain, and in straining, it's going to pull excessively on its attachment to the lower back. Well, if you're having pain at your lower back, who says that that means it's coming from the structure? Isn't it possible that this muscle is strained and is pulling excessively on the structure, and that's why you're feeling pain near your spine? Is there any other indicator, a symptom, that would represent that what I'm saying is correct? Well, what if, along with that lower back pain, you would also notice that if you sit for some period of time and you go to stand up, you can't. That you have to slowly maybe push yourself up with your hands on your thighs to get you to stand up. That's representing an indication that your hip flexors are shortened, and in sitting, they shorten to the point where when you go to stand up, they're having difficulty lengthening again. That would be another reinforcing point to the fact that that lower back pain is coming from a muscle, not your structure. What if we looked at your spine from the side, and instead of having a very subtle curve, you have an extreme curve, and this is the front of your body, this is the back of your body, and you have an excessive arch. What about an excessive arch? Does that mean something? Well, that excessive arch isn't magical. It's not arbitrary. It didn't just come there. That arch is coming because muscles like the hip flexors, remember I said they start at the back and they go anteriorly to the hip. They're actually shortening and pulling the back forward, which is altering your posture from a very subtle arch to an excessive arch. So an excessive arch, again, is another symptom representing that your pain is from muscle, not your vertebrae or structure at the lumbar spine. How about the fact that when you bend forward, you have a major difficulty, and when you bend forward, you would see for someone to typically bend forward, you have to start with an arch, and then eventually when you bend forward, it actually rounds and becomes rounded. So you go from an arch, so that's a normal way that the back works. What if you find that you have difficulty bending down and you have pain at the lumbar spine, and you also notice that you're not rounding out, that you're remaining arched, concave? Another physical indicator that the cause of your pain is muscular. So what you start to see are that there are multiple physical indicators to reinforce the point that the cause is muscular, not structural. But you go to that psychopath doctor who has been brainwashed in their education and makes no attempt to look at your body. Everyone would acknowledge that when you go to the doctor, you're there for 3 to 4 minutes, just long enough to get the prescription so you can get your MRI. And in discussing what's causing your pain, there's never a discussion of your body. No presentation of symptoms. It's only a question of what is the resultant that was found, the interpretation from the MRI. That is your diagnosis. And yet, overwhelmingly, there are physical presentation, physical symptoms that are saying without question, it couldn't be the structural variation. And I guess that's what always enrages me and why I've been on this quest to try to get this information out to so many people. You go get a back fusion for stenosis when any one of these symptoms are indicating that you have a muscular cause creating a symptom. You got to be crazy to go down that path. And I understand you go down that path because you've been found, you get to that end of the road where you feel there's no other choice. But that's only because you've never heard an alternative. It doesn't matter who you go to in the medical system. It doesn't matter what the specialty is. The medical system bases their diagnoses on MRI and X-ray findings. So it doesn't matter if you think you're getting a second opinion, you're not. As long as the opinion is based on MRI findings, you are getting a baseless diagnosis. Diana wrote, I was completely misinformed about anatomy and the cause of pain. Now I'm educated finally. After having pain for 8 or 9 years, I'm out of pain. Yes to Yass. Thanks, Diane. Diana, that's the key. And that's why I'm doing this. People will always say to me, why don't you try to educate the medical system? The medical system doesn't want to be educated. Just remember that this is a fee-for-service basis. The medical system is the only industry that works on a fee-for-service basis, which is to say, you show up, you get treated, they get paid. Outcome is not a factor in payment. Remember that. Just imagine you just had a multiple level surgery fusion, which costs $250,000 to $300,000. You end up with the same exact pain. In fact, you're given the diagnosis, failed back surgery syndrome. The diagnosis given has the word failed in it. Does that surgeon get paid that $250,000 without question? So understanding that, whether it's a chiropractor, a physical therapist, a podiatrist, a rheumatologist, an orthopedist, it doesn't matter. What's the incentive at this point to try to move to a system that actually has a higher propensity towards identifying the cause of pain and resolving it? There's nothing, right? The goal is to keep the numbers up. And with you not having a recognition that there's an alternative, what stops you from staying in the cycle? As long as the structural variation is identified and you can continue to be made to believe that that's the cause of your symptoms, you're a prisoner. You stay in the system forever. And you stay with that mindset, well, that's my diagnosis and there's nothing more I can do about that, so I got to just keep trying to do different types of treatments. There's that psychotic principle of prolotherapy. That's got to be one of the sickest premises out there. Some schmuck comes up with the idea that inflammation of your ligaments is what's causing your pain at your back, and they inject sugar water into your spine. There's so many things wrong with that. Number one, how did they determine? What is the physical presentation to say that the cause of your pain, the tissue in distress, is the ligaments? Number two, what is the presentation that inflammation exists? For there to be inflammation, there must be pain, swelling, heat, and tenderness. 4 symptoms. Everybody I've ever treated who had back pain didn't have any swelling, heat, or redness. So it doesn't even appear that inflammation. So there's no indication that the ligaments, no physical presentation to say ligaments are the tissue in distress, no indication that inflammation exists, and yet people are getting prolotherapy, sugar water injected into their spine. And it's about a $5,000 to $10,000 process, which isn't paid for by insurance. And yet people do it. These guys stay in business. Why? Because the person doesn't know there's an alternative. It doesn't matter who they go to. The diagnosis is what the MRI says. So I just have to keep trying to find treatments to address the structural variations identified. And it's all crap. It's meaningless, baseless. Look at the studies I just showed here. By the way, if anyone wants copies of those studies, I will happily send you links for those studies so you can see them yourselves. And all you have to do is email me at drmitch@mitchellyass.com, and I'll be happy to send you those links. I'd love to get these studies out so people will see. There's overwhelming evidence. Every bit of evidence says that the use of the MRI is baseless, and yet it's constantly used, and I mean globally. And the reason is pure propaganda. 40 years of telling you that you can talk to anybody. Do herniated disc cause pain? Sure, of course. Does arthritis cause pain? Absolutely. And yet it doesn't. Neither do. Neither can. Neither can. A disc is made of fibrocartilage. Fibrocartilage doesn't even have pain receptors in them. So the disc itself cannot elicit pain. I can stick a knife in a disc and you would never know that. Arthritis, osteoarthritis, is a mechanical wearing down of joint surfaces and takes so slow in its process of degeneration, it takes years, if not decades, to develop, that it doesn't elicit pain. And in fact, in the case of osteoarthritis, studies have shown there's not even a relationship. It's not even close. There's no relationship between the extent of the structural variation and the intensity of pain, which should shock the crap out of you. You are being told, wow, you're getting more and more arthritis, therefore that must mean it's causing your pain. Well, what if I told you there are people who have massive levels of arthritis and virtually no pain, and then there are people with virtually no arthritis and incredible amounts of pain? Shouldn't that correlation of the severity of arthritis and the severity of pain scare you? Shouldn't it make you question whether what you're being told is valid or not. And then there's this whole issue, which really gets insane. In this case, in terms of the lower back, the possibility of these two muscles being the cause of your pain, which most people will acknowledge that pain is not directly on their spine. It's actually off to the side 2 to 3 inches or even an inch off, which is exactly where these two muscles are. How do these two muscle strains show up on an MRI? They don't. They don't. No x-ray. The guy's interpreting the x-ray or the MRI. The doctor you're going to who's trying to give you a diagnosis never shows up. As far as they're concerned, this doesn't exist. This picture with all this muscle doesn't exist. That should scare you. How is it possible that all of this exists and this can't be the cause of your pain, when in fact your symptoms are all representing it is the cause of your pain? What if you take a hot shower and your lower back pain is diminished and you were told that the cause of the pain was stenosis or arthritis or a pinched nerve? Are you saying that somehow hot water actually reverses stenosis or reverses a herniated disc or reverses a pinched nerve? You see the insanity of that? The symptoms have to count. That's the lesson you must learn. And that's the lesson of the Yass method. If you are tired of being in pain, if you're tired of developing hopelessness and a sense that tomorrow's going to be the same and wondering how long you could live in pain, there's very few options you have. You could stay with the medical system, which has failed you miserably. You can go on addictive prescription pain medication, which in fact is a form of heroin, and get addicted to that. Or you're going to live in pain and just say, how long can I take this? Or you could say there's something better than that, and it's actually outside the system, which is the Yass method. There's a lot of people saying they have a lot of methods. Which of those methods are diagnostic models? Which are treatment models? That's what you better understand. If it's just another treatment model, it's worth shit. Doesn't mean anything to you, right? It can't mean anything to you because the diagnosis is still failed. You're still using a false diagnosis. So all the treatments in the world aren't going to get you anywhere if you're not treating the right tissue. You need a diagnostic model. And that's what the Yass method is. It's a way of identifying what tissue's in distress based on the body's presentation of symptoms. No better way is there to understand what tissue's in distress than understanding what the body is presenting, because that symptom you're feeling is coming from the tissue in distress. In 98% of cases, it's muscle. 98% of cases. 130 million Americans, 1 billion people. 98% of those people could see their pain resolved quickly and effectively if they simply recognize the cause is muscular and recognize that all they have to do is identify which muscles are involved, perform the proper exercises with progressive resistance. It's over. Game over. You are pain-free and fully functional. So with that understanding, please try to reach out and get the Yass method. I've put it out here again. Dr. Mitch at mitchellyass.com is my email address. If you want to get more information, just general information about the Yass method, you've got the YouTube channel. We have Facebook, which is at the Yass method. You go on my website, mitchellyass.com, and we have a whole section there, the blog section, and there's 80 to 100 posts there. Please try to spread the word of the Yass method. If you like what I'm talking about, if this is making sense to anybody, please subscribe to my channel. Get those who are in pain to look at this information. If they think it makes sense, please subscribe. I want to try to get these numbers up so that I get a higher rating in Google search, and Google will be able to spread this information more, and we could really try to coalesce around the idea that the answer for most people isn't that they're in chronic pain because they're not getting the right treatment. It's because they've got the wrong diagnosis. So let's try to all work together. They keep talking about that with the coronavirus. We need to work together. Well, trust me, for the issue of chronic pain, we all need to get together and work together to try to change the system. So this, hopefully, is the vehicle by which people recognize this is the path. Okay, for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. We'll see you next week. If I could be of any service, if you need the Yass method, please contact me. Let's help you. Let's help your friends, your coworkers, your family resolve their pain and get back the life they so justly deserve. For now, bye-bye.